portion, what I'd like to discuss with folks is a section that I call working with patients. Diagnosis, assessment, and initial treatment strategies. So what I mean by that is, as opposed to just giving the herbs, at this point is how do you assess or diagnose the situation and decide what course of action to take, plus what are some of the better forms of medicines to give to the patients and how to help them take them, increase their compliance. The word compliance is important here. Compliance is the ability of the patient to actually take the medicines. So I want to talk a little bit about one of the important things about first aid, and that is, and I've mentioned it before, and it'll come up again, is that stress makes everything worse. And so first aid situations almost always have a degree of stress involvement because it's acute, it's sudden, it wasn't expected. Not that most diseases are, but something like a cold or a flu, you get a little bit of signs from it and then you get worse and worse, and you kind of have a sense of what's going on, or other people are sick around you. If somebody has an acute health problem, if they have a first aid situation, you also might want to see what else potentially will go wrong with them. What I'm talking about is exacerbations of chronic health problems. So if they have a real tendency for, let's say, panic attacks, if we can call that a chronic health problem, trying to alleviate that or prevent that before it happens, or if they have irritable bowel syndrome and they've just had a situation that might set them up for the irritable bowel symptoms, such as diarrhea, you might help prevent that before it happens. And once again, importantly, make sure that you treat yourself and relax yourself and take deep breaths and take walks, do whatever you find necessary to reduce your own stress levels. And also, if you're someone like myself who brings groups of people to do first aid, be aware that also helping your students or comrades or whomever else you're working with reduce their levels of stress as well, so that people can perform higher functioning. There are some of the major categories for stress reduction include anti-inflammatories, as odd as it sounds, because a lot of times stress is associated with pain, and many forms of pain are inflammatory pain. So often just giving gentle herbs like marshmallow root or turmeric or ginger, which are anti-inflammatories, reduce stress by reducing excess pain, like just wherever people are holding it, to help lower that threshold. The common name of things that reduce anxiety, anxiety being a form of stress, are called anxiolytics. So lytic means to reduce. Anxio is just a way of reducing the word anxiety. So anxiolytics can help reduce anxiety. A famous one, for instance, is kava kava. But for some people, peppermint is an anxiolytic, and just the flavor and the taste, the memories of it will reduce stress levels. So what I'm talking about here is helping yourself and other people around you with stress. All kinds of pain medicines, including things like ethanol. Some people smoke cannabis or take it in other forms. So those are all other ideas. Sometimes they're called inebriants. And at the right time in the right place, if there's not a problem associated with it, some inebriants can help reduce tension, particularly at the end of the day. Right? While you're working with people, it's much better to not be inebriated. But sometimes, especially people who are new to this, like if you've been doing a lot of first aid work, usually you know who you are at the end of the day and you know how to reduce that kind of level of tension. But for a lot of people who are new, what happens, I've seen it over and over again, is at the end of their day, they are so wound up that they can't sleep and they're just like all tight. And so whatever is helpful, kava kava against a beer, a cup of peppermint chamomile tea, whatever necessary to help reduce that level. So pain medicines in general, a lot of them are also relaxing, especially the pain category called sedatives. So not all pain-reducing herbs are sedatives, but those that allay or reduce a sense of excitement can be helpful. So sedative herbs. Sleep aids can be very helpful. Here's something like valerian root. For people who don't have a problem with valerian, can be very helpful. So they sleep better and the stress levels are reduced. And then a group of herbs we're going to cover later that I call trauma aids. And trauma aids are those plants that reduce the people's sense of tension and held-onness after they've been in a traumatic situation. So those are trauma aids. A traumatic situation could be a bee sting or a dog bite or a falling down injury, car accident. It could be really anything where the person has a sense of like something went wrong and they're holding it in their body. Those are some, so we're going to talk about diagnosis and assessment. And I started off by saying these are herbs that help actually assess people because you might be in a more relaxed state, not inebriated, just more relaxed. And also by helping sometimes your patients' stressful states, you can get a better sense of what's going wrong and what's going on, what's going right. So your skill level is also going to be important. And it's not easy to ascertain what your skill level is and what you should be working in because you might be the only person in a situation. And your goal, though, is to deliver the best quality of care that you can provide with your skill level, knowing whether you can do it or if you have to start immediately seeking help elsewhere. And, you know, just things in your mind you want to consider is when do you feel like you need to collaborate with other medical professionals or other holistic healthcare practitioners? When is it time to send somebody to a hospital? Considerations for hospitals is the hospitals themselves is also just the expense. It's going to cost thousands of dollars. It's going to cost thousands of dollars going to a hospital for even the slightest thing. And then if it's more the more expensive the care, the more expensive the care as well. There's considerations. What I want to go more specifically now is diagnosis and assessment. The word diagnosis is generally a medically protected word, and it's a word that you want to be careful about using. When you diagnose somebody, you're naming a disease or a named syndrome, so irritable bowel syndrome, or you're saying somebody has influenza virus. So that's kind of a technicality of what diagnosis is. Sometimes we can probably make diagnosis. There's a bunch of people that seem to have a cold or a flu and they've been diagnosed, and then other people have the same symptoms. But in general, what we're going to do is assess people's symptoms and make a discernment based on the symptoms rather than a named disease. It's an important differentiation. So when somebody comes to me and says, I have alternating diarrhea and constipation, and it happens with stress, and it might sound to me like irritable bowel syndrome, that's what I might say. I would say it sounds like irritable bowel syndrome, but what we're going to work with is your symptoms, which are alternating diarrhea and constipation. So I'm not going to name the disease. That's the diagnosis. I'm not going to say you have irritable bowel syndrome, but I could say this looks like irritable bowel syndrome. We could treat it similarly to that. It's a legal safe ground, and honestly, I think it's an ethical safe ground. I think that I don't really know until somebody does the lab test, the medical workups, that I'm just naming the symptoms. So everybody makes their own decision on how much to decide whether they're diagnosing or using words like treatment. When I'm diagnosing people, in first aid it's a little different than in general, in chronic healthcare, like in a free clinic. So there are two main forms in general when you're diagnosing people, when you're assessing people's health. One aspect of it is a pathophysiological aspect. And by pathophysiological, I mean what actually is wrong with their body. They have inflammation in their lungs. They have excessive peristalsis in their large intestines. They have certain disorders that you can trace back to the functioning in their body and say this part of your body its functions are altered in order to give you this condition. So if somebody has bronchitis, you might say that they have inflammation of their bronchi, which is constricting their breathing. So the pathophysiology of that, or the pathophysiology of a staph infection and how staph bacteria could colonize and invade an open wound and how their toxins can start a reaction and how the wound doesn't close, that's all a pathophysiological sense. For me, I pretty much always want to know the pathophysiology. So physiology is how things function, and pathophysiology is the sickness of how things function, how things go wrong in the way our body functions. So lots, if we talk about, once again, irritable bowel disease, irritable bowel syndrome is basically, its pathophysiology is the nerve complexes within the enteric and myenteric complexes, nerves in the intestines, and they're having spastic peristalsis. So that's the pathophysiology. For me, it's helpful. For you, it would be helpful too, knowing it's a nervous system disorder, really, not so much a tissue disorder, and it gives you directions how to treat it. So sometimes in first aid, you're going to have an understanding of the pathophysiology, but it's often not quite as important here. In chronic healthcare, when people name their diseases, tell you what their diagnosis can be more helpful. The other part, so there's pathophysiology, and the other part is constitutional. I use Ayurveda as a constitutional model, and I use the doshas, Vata, Pitta, and Kapha, and they're helpful for me to assess the kind of person I'm working with and why this potential problem, this pathophysiology, is affecting their body type. So having a constitutional model of healthcare, just simple constitutions, is somebody who's more sthenic or asthenic, somebody who's stronger or somebody who's weaker. And just things like somebody's more excess type of body or somebody's more of a deficient type of body. Somebody who has more stagnant health conditions, things get in there and stick. Somebody has more windy health conditions. The problem just keeps moving throughout their body and goes into remission and comes back. So it's important to have a constitutional model. Once again, in chronic healthcare, it's more important. In first aid, the constitutional part comes in because often it has to do with how you're going to dose the person, how you're going to set up the dosage regimen for your herbal medicines. So somebody who's more of a deficient constitution or somebody who's just more sensitive might need less herbs or more often. Some people are very sthenic or strong, might potentially just need more medicines more often or less often. There's two main parts to diagnosing people, there's two main parts to treating. There's how much of the medicine you give at a time and how often you give it. Sometimes in first aid, for instance, with an infection, your initial dosage, your first time you give them a dosage, the first time you give them a medicine, and maybe the next few hours, often it's really high, both in frequency and amounts. So if somebody got bit by a dog, I might suggest something like echinacea and osha, and I might suggest like 2 dropperfuls of echinacea, 1 dropperful of osha every hour or two. So that's high amounts and high frequency. Maybe after 2 days with no more signs of infections, or even the second day, maybe I'll say 1 dropperful of one and a half dropperful of the other every 3 hours. So we've lowered both the amount and the frequency of it. So they're important considerations, how much they take per time and how often they take it. Once again, communication with your patient and other folks is very important. So it's important to understand how you are, maybe getting reflection from people around you, how you relate and how you discuss and how you communicate with your patient. So that's often called bedside manner, or you can call it counseling. But how you address them and how you make them feel will increase their ability or decrease, like will they listen to you and take your recommendations, including the medicines that you suggest. Also, you might be addressing other medical care workers. One year we had an outbreak of a contagious disease, and all of a sudden around me there was all these other people, medical personnel, health personnel from the local counties, and they wanted to know what we were doing, and just addressing them could be very important in how you present yourself. If you don't want to be in that position, if you don't want to interact with legal authorities and health personnel, just don't. Usually there's somebody else who's glad to do it. So it's something that I like to do some of the time, but it's not the job that everybody will do. There's another person you might interact and do first aid, and that's the media. And in general, when I'm doing first aid, I'm not interested in interacting with the media. They have their own take on things. Like right now, this is very media that I'm doing, but it's also very controlled. When you're working in first aid situations, I just find sometimes they take what I say, totally bastardize it, and then present it as something that it just seems inaccurate to whom I am and how I'm practicing. And there's usually lots of people who really enjoy interacting with the media. So that's something some people do. And then there's law enforcement. Somebody gets really badly hurt, there might be a police person there, and you might be interacting with the police, and just how you'll do that. So communication with your patient, communication with health personnel, communication with legal authorities, and also interactions with the family and friends. If somebody's really sick, they may be brought in for other people, how to help appease them, make them feel better, give them the information, and educate. So those are communication aspects, which is just going on with this whole thing about working with patients. Legalities is a very complex topic that won't be covered here. The important thing to know is that if you are licensed in another discipline, you might be practicing out of your scope of practice, and it's just something to look into. If you're not licensed, usually you're much safer grounds. So what I'd like to do now is talk about some of the differences in assessment in a first aid situation as opposed to working in a clinic or just seeing people in your home. So in a first aid situation versus non-first aid situation. So the difference between diagnosing and assessing in first aid is the immediacy. You know, somebody runs in and says, I have this, or this has just happened, or this is going on. There's often a bit of heightened awareness or heightened state or stress or anxiety, but there's an immediacy. And I've just already discussed some of the herbs to help before about stress and reducing immediacy, reducing the stress associated with immediacy. But that changes it. When somebody comes to see you as a patient and calls you up 2 weeks ahead and said, I have Lyme disease symptoms, will you work with me? And you say yes. And they come by. I mean, it's a very different situation. So immediacy. Some of the things that come in involved with assessing during immediacy is you're not going to have any kind of detailed intake. You're basically going to be asking questions on the spot, as opposed to having an intake form that they're going to be working with and through you. There will probably be no lab diagnosis. So this doesn't involve things that are exacerbations of pre-existing conditions, but lab diagnosis are not going to be a part of, you know, somebody has like a bacterial culture or diarrhea, you can send for labs of sometimes, but initially you're going to be treating without getting lab reports back. The other thing is you may or may not have anybody to collaborate with. So if you're seeing people outside, you have internet access, there's people to call up. Right now it's you and them. And so that immediacy and that interpersonal interaction changes the situation. Previously I've mentioned triage, but that's something else that shows up in a first aid situation. Triage is not a part of clinic healthcare. If somebody's had an accident or a health condition in first aid, it's important to assess what just happened to them and try to figure it out. So in other words, if somebody's taken a tumble down a hill and they've hurt themselves, they'll often have an obvious point. Their knee is strained or their elbow hurts or they have a big lump on their head. But other smaller things sometimes get unnoticed. So I want to point out that if you're assessing people, especially after a physical accident, whether it's car accidents or taking a fall accidents or just injuries of any kind, often some serious things can go on or places that are injured that just don't get noticed because something else is so much more obvious. So I'm suggesting in these situations is to first go through the obvious, like you have a big lump on your head, and then saying, how are your legs, how are your arms, how's your digestive tract, how is everything else working? So looking for the less obvious. If you're working with people, one of the simple things to ask is, have they ever had this problem before, and how have they treated it? So in other words, not reinventing a whole new treatment strategy based on something that people are familiar with. So somebody comes in and they have diarrhea. Diarrhea is just very common. It's why it comes up in this conversation. They come in with diarrhea, and one of the first questions you're going to ask is, do you often have diarrhea? And the person says, well, actually, I get diarrhea whenever I'm in new situations. And then you might say, what do you do for your diarrhea? And they go, oh, actually, chamomile tea and peppermint spirits tincture help my diarrhea. And then you're like, well, I have those. Will those work for you? So what you've just done is you've taken out, instead of spending hours on trying to figure it out, you have a much more direct approach and you can save a lot of time. So asking, have they had this problem before? And how have they absolved it in the past? And do you have the resources, or can you make up the resources? If they've done it with, let's say, turmeric, and you're like, oh, I don't have turmeric, but I have ginger, another anti-inflammatory that's related, maybe you can use that system. When you first, this is a little bit on the triage scope of things, but when you're first assessing people's health issues, when you're working with them, just casually look at them, right? In other words, instead of staring at them, and just try to assess how healthy are they. You can also ask, how healthy are you generally? Because sometimes people come in who have been really sick with something and they look terrible. And to your mind, they just seem really weak and not with it. But when you ask them, they're like, oh, actually, I'm usually really healthy, but this back pain has just made me miserable. But, in general, I'm just a pretty healthy person. So one thing to assess is the general vitality. You can ask about general vitality. You'd also just look at them. Sometimes people will come in and they're in a lot of pain, but you looking at them, you get a sense of actually they're pretty sthenic or pretty strong. And so the stronger in a sense they are, the more attributes, the less things that go wrong with them, the better your chances are of helping them quicker. Right? The more native strength that they have, the easier it is to treat. So So that's just basically looking at the person, asking a few questions. In most situations people will be working at, your patient is conscious, meaning that they're awake and aware and can answer your questions. But if people bring somebody in who's unconscious, there's a few steps I'm going to cover very briefly here. The most important thing is make sure the people who brought the person in stay there, right? Because sometimes people are having fun and you're at some music event, and some people come across somebody that's laying out in the sun and passed out, and they bring them to you, but they want to go dancing. So it's just a matter of they bring the person to you and you say, if you can wait here a few minutes, and they might say, well, and then you just say it's important. You try to convince them that you need to ask them some questions, because one simple thing might be, if they found them somewhere, is that place that they found them, is that near where you're going to go back to? I mean, is it in the middle of a field, or is it actually right in front of their tent and they just didn't know it? So when you're working with somebody who's less conscious or unconscious, like somebody could be just not very aware, let's say they're just extremely dehydrated and limited awareness, and you're working with other people around them, you can ask them certain questions. So when you come into a situation where the person can't really answer for themselves, and you're working with other people, make sure, first try to figure out who's the most competent person with the most amount of information, because they're who you want. The story relayer, the person with the information, is going to be your primary person. So, the person who just has a sense of what's going on. So you keep them, the other people can probably leave. If you're in a situation, the person's not conscious, or we even in this situation are, and there's a lot of people making a lot of noise, you have to learn how to quiet other people down to ascertain what's going on. So it's important to also just consider not only finding one person who knows what's going on, but quieting down or dispersing people who are disruptive to the process. And then one way if one person knows more, if you just give them more attention, they're more likely to stay. If you just say, what's your name, introduce yourself, and then you go on from there. This can be very important, things like people with seizures. So you come into a situation where somebody has a seizure, somebody seems like they've been there longer and has a sense. You want that person there so you can get as much information as possible. If you're working with people and they start to feel better from whatever the situation is, you still want to monitor people. So let's say somebody comes in and kind of really weak and tired, and they're just dehydrated. They haven't drank water. They've been out all day. And you give them water and they start to feel better. I would probably still have them sit for 5 minutes and just make sure no sequelae, no other problems are going to emerge. So if people come in initially and the herbs help and the treatments help, you might want to monitor them. And the more serious the problem, like if the person had difficulty breathing, they're having an asthma attack, and you gave them medicines to help them with the asthma attack, and then they feel much better, whether it was herbs, let's say you gave them some lobelia tincture for the asthma. Then later on, even 5 minutes, 10 minutes, you still want to make sure that they have some monitoring, especially if they're not aware, if they haven't had this situation before, to make sure that their asthma doesn't come back on worse than ever later, in which case the person will need some immediate help. One thing that's always important when assessing people is if they have a lack of body sensation. So if they can't feel their feet, if they can't feel their hands, or other parts of the body are numb, it's just a consideration that something more serious might be going on. If it happens in first aid, it's often because they've been into an accident. If that's true, you might want to immediately consider getting them just more professional help to figure out what went wrong. Because if you can't feel your body part, your nerve endings there aren't functioning properly, which doesn't have to be negative. You can fall asleep on your body part and not feel it, and that's not a big problem. You just have to get off the body part and let your blood flow come back in. But in a situation, you might want to really consider the problems for this, like if they can't feel a piece of their body. So a little bit about history taking. What I'm not doing in this segment now, right here, is I'm not really discussing how to treat diagnose specific conditions, let's say endoparasites or skeletal muscle injuries. What I'm just trying to do is give broad overviews to consider, and these are just basic guidelines to work with the people. And then when we cover specific diseases, we'll discuss the specific forms of diagnosis and assessment. So history taking tends to be very reduced in first aid situations. There are some things that could be helpful. I've already mentioned one of the most common, which is, have you had this problem before? You can also ask, does anybody in your family have this problem? So they're feeling dizzy and they have vertigo, and you say, does anybody in your family have vertigo? And they say, yes, actually, my mother has vertigo, has been treated for it for years. You still have to treat them, but you're thinking, this could be a part of a complex that they can find out more information about later. So it could be helpful in first aid. There are a lot of first aid situations, of course, are not chronic problems. Like you don't have to ask if the person seems to hurt themselves. You don't really have to ask, do you have other clumsy relatives? Sometimes people will give you apparent, obvious information, important stuff, but sometimes not. So if somebody got stung by a bee, for instance, and they come in, it's pretty important to say to them, do you have any allergic responses to bee stings? Most people will offer it. Most people, in fact, when they have bee stings and they are allergic, they come in panicky. But sometimes people just don't offer this information. So it's simple enough to ask, have you had this problem before? Does this particular problem trigger anything for you in other situations or anything similar? So asking them, this is not what usually happens, but have you gotten sick in similar problems where you've had sequelae or further reactions? If the situation has happened with them before, so they have really bad headaches, for instance, or digestive disorders, some of the questions to ask them in a quick intake, a quick history, is what were the triggers for this problem previously? So what causes headaches or diarrhea for you in general? What in the past has worked and what has not worked, so you don't have to give them things that you know not work. And then each specific circumstance will have specific protocols associated with them. So for instance, if they have diarrhea, things like what did you last eat? Is anybody else around you sick? Does this kind of thing happen before? So there's general questions and then specific questions to the situations. You can also just ask if people don't feel well, like a kind of a list of things that they might not be thinking about which are going on. So what I want to say, somebody comes in and they have a headache or they have diarrhea or they have an injury, you might just ask them, do you have any other physical anomalies? Do you have any other problems that you don't usually associate? And they might say, actually, I have ringing in the ears, and I never have ringing in the ears. So an anomaly or something that's uncommon for them happening at the same time. If they're female-bodied, you might ask them about, and they're during their menstrual years, you might ask, are there any alteration of menses? Hormonal problems will often show up. So this is going to not be so much in chronic health care. This doesn't show up so much in acute health care, but asking if there's any alteration of menstrual patterns, of menses, menstruation, which might give you an indication that the problem has really changed. If a woman all of a sudden abruptly stops mensing or the problem's been going on, and then this has changed, it could just say that the body has triggered a response hormonally to an immediate reaction. But once again, in first aid, you don't usually see alterations in menstrual patterns. That's usually, you see that more in chronic health care. Ask about digestion. As we'll talk about digestion, there is as many nerve endings, there's many nerve cells in your digestive tract as your brain. Well, it's pretty big. It's just very nervous tissue oriented. And so a lot of healthcare problems showing up elsewhere will affect people's digestion. For instance, stress will make people nauseous. Stress will make people anorexic without an appetite, those kinds of things. You might ask about dizziness in general, headaches, lethargy, pains that weren't there before, changes in bowel habits and bowel form, and swelling. They're having any swelling that's unusual. So these are just some of the questions to ask when working this situation. Before giving any internal medicines, one of the most important things, if it's tinctures, just to make sure that they don't have any difficulty with alcohol. You can ask them, do they have favorite medicines? What's helped before? Before giving them medicines, you might want to consider constitutional approaches. If you know TCM, 5-element, or Ayurveda, you might want to use some of that to assess internal situations. You might want to do pulse reading, or you might want to ask some questions to help you ascertain the person's doshas. And we've discussed it. Do they have windy conditions and excesses and deficiencies, those kinds of things. Sometimes, if you're not sure what's going on, you can ask the person if there's been any change in their urine. I usually do this more, though, if there's problems with dehydration. But you can ask people, has your urine been altered lately? For instance, they normally pee 5 or 6 times a day, and now they've only peed once or twice a day, showing that something's going on with their body. The consistency of the urine, meaning the thickness, the volume, the color. So without a lab, one way of knowing what's going on internally might just be having the person evaluate their own urine. Though urine changes all those things, regularly, depending on what's going on with your bloodstream and what you're putting into your body. But it's just some more information. If you know physical assessment or physical examination, such as the Bates method, that can be very helpful, how to palpate and feel different parts of the body to make sure where the injury is on them, if it is an injury. If you're going to palpate and try to feel people's injuries, so if somebody has a hurt knee and you're feeling their knee, and so you're putting pressure on their knee, at the same time, you also want to be watching their face. So if let's say somebody hurts their knee and you're trying to figure out where the injury is by putting pressure on their knee, you might also want to be looking at their face. You do want to be, because it might hurt a lot, excuse me. And many people don't say when they have pain, they just grimace. So they just grimacing. So anybody else watching them will see this person grimacing and making crazy, ugly faces in response to pain. And you're just totally oblivious to it because you're down here working on their knee. So what I'm suggesting is whenever you start to palpate, so if you start to feel part of their body or organ, make sure that you're looking at their face and make sure that you're not causing more undue pain. Sometimes you're going to be causing a little bit of pain because as you're looking for the places that hurt. But that's important. So watch their face when you're working with people, and then you don't even have to ask all the time. They'll just start grimacing and tightening up, especially if it's like you're working on the lower body, like knees and feet, because people don't tighten up there as much as they tighten up the top. So those are some very basic assessment tools, diagnosing and initially working with treatments. What I want to discuss a little bit is helping your patients take their medicines. The term for that is patient compliance. We as herbalists have more difficulty with compliance for a lot of reasons. I want to discuss some of these reasons with you. And a lot of you know them, and a lot of them seem intuitive. But if you understand why we sometimes get low compliance, you can help increase the compliance by working against the reason that they don't comply. When you're giving people medicines, ask them if they are willing to take the medicine. So I think it just gets overlooked. So you're like, I would like to give you this tincture or this tea or this oil. Are you the kind of person that will take this medicine regularly? And after you ask that, listen. Many people will say, no, actually, I'm the kind of person that will take it right now and never take it again. At that point, you could try to convince them to take the medicine, but you might just be wasting your time and energy and medicine. The person has clearly stated to you that they're not the kind of person to regularly take their medicine. So just work with that. So can you give them enough medicine right now in front of them to take it? So ask and then listen to what they're saying, and don't try to force your will in some subtle way, like you will take the medicines. You will take the medicines, and then they take them. Though you could try to convince them. They could say something like, I don't regularly take medicines. Should I take them regularly? And you can hear the openness in their voice. You say, you could, and if you will, I'd like to discuss how to take the medicines. Most of this, what I'm going to be talking about here, is just in first aid situations. Compliance in a free clinic or compliance seeing people with chronic healthcare problems is different often than in first aid situations. One of the things that I suggest that's really helped compliance, meaning people taking medicines and not getting the grossest looking faces, is after testing a medicine for a drop or two with people, is the way that I give people medicines, particularly tinctures. And how I administer tinctures in first aid is I get a bunch of disposable cups. Once again, unfortunately, first aid is the land of disposability, or they can use their own cup if they have one. But I have small disposable cups, and what I will do, let's say I'm going to give them some Oregon grapefruit because they're having a digestive disorder that's infectious, and I'm giving them Oregon grapefruit for a digestive infection. So what I'm going to do is I'll get a cup, and I'll put a bunch of water in the cup first, and then the tincture. The compliance goes up. It still is pretty strong tasting, but having lots of experience giving people droppers. Most of us, a lot of you watching this, you take herbal medicines regularly and you just think that Oregon grapefruit tastes okay, or it doesn't taste that good, but you can take it. There are many people out there that you give them a dropper full of Oregon grapefruit without setting them up, and they will never take herbal medicine again. So it's unexpected for them. So what you're going to do is, one way to make this easier is you get a cup. First you put the water in the cup. It's important water first. If you put the tincture in, the tincture will start to absorb into the sides of a paper cup. Not a wax cup, but I tend to use the least expensive disposable cups and the most disposable. These, I can burn these, which are the paper cups. So a paper cup's water first and then whatever amount of tincture. So that's one way. The second thing to do is I just don't BS about the flavor of medicines. If you've listened to any of this before, you know that I'm likely to call these things nasty tasting. Now, I can drink chaparral tea, I can drink yarrow, I can drink mugwort, motherwort, hops, but most people, these are very nasty tastes. And so one thing about is just saying, this doesn't taste very good. Are you okay with that? And some people will say, no, I can't. I hate disgusting flavored stuff. Then you have to change your course of what you're going to treat them. But if you could already, by saying this, they're like, okay, and they can close their eyes and drink it, especially if it's dilute in water, they could just chug it down. So after they chug it down, so they cup out, water in, tincture in, they pour that down as a shot, let's say if they're taking it. The next thing you do is you refill it with water so they could do a few chasers so they can chase the taste of the medicine. But I just say let them know that it's really everything we mostly have is gross flavored. Some people, of course, will say, I love peppermint tea or chamomile tea, or I can drink chaparral tea. But a lot of people are unprepared for the flavors of herbal medicine. And by letting them know, I think that we help the situation. You can also just ask people, have they ever taken herbal medicines before? To many people, you might be the first herbalist. You know, say they come to a first aid booth at a musical event, and they're talking to you, and it's just total, everything is new to them, right? There's all this stuff in these jars, and who you are, and how you approach them, the questions you're asking them. They're unusual. So I would just say, have you ever seen an herbalist before? And have you ever taken herbal medicine? It gives you a sense of how you can proceed further with this. Affordability is often a factor, but it won't be a big factor in first aid unless they have to continue taking their medicines later. So I just want to say that general accessibility and affordability are two major determinants in treating people, but not so much in first aid, because you're probably just giving them free medicine, and the accessibility is you, and they can just keep coming back and taking it. One of the reasons for low compliance in general is just unclear directions in how to take stuff. So if the person is coming to you at the first aid station, and this is a compliance problem in itself. If you're doing first aid and somebody injures themselves, so I'm going to go off topic for a minute and just talk about how are they going to get the medicines. So you work in a first aid booth and somebody injures their knee and you want to give them arnica tincture in small amounts internally and larger amounts externally for their inflammation. Can they get there over and over again, right? If they have to walk to see you and their knee hurts and you're telling them you should rest your knee, and they have to keep coming to you, you're going to have low compliance just because they don't have the medicines. So you have to think about how are you going to give these medicines to people so that they can take them back to their homes, to their tents, to their cars, to whatever situation it is, so they don't have to continually come back and take the medicine in a first aid event. So one way to do it is you can have, I have these small plastic vials that somebody gave me that they're pretty inexpensive, so the person can bring that with them. And you can also put medicine, in emergencies, we put them in plastic bags with a little bit of water, and they can just take that and tie it up. You have to improv with it. My favorite thing, though, is to have these small plastic vials, but it's going to cost you money, and it's more waste, but it's helpful because if they have a lid on them, they just won't open up so easily. Sometimes you can find these things in inexpensive lots when people are getting rid of a lot of equipment at once. The ones I'm using now were donated by somebody who works in a clinic at a needle exchange clinic in Seattle, and they use these bottles, these small bottles, for people to clean their needleworks. And he just brought us a whole bunch of them, which was incredibly useful. And after 2 years, I had a couple of hundred. I've run out. So I'm saying so much. It's not you need to go there. Is that there are ways to improv to get things to put the medicines in, so people can take it with them. So we have, can you give them medicines to take away so your compliance goes up because they don't have to come back? But if they don't come back, you have to be really explicit with your instructions. Don't just say things, show. So demonstrations really reach people's brains better. So if you say, take 2 dropperfuls from this twice an hour, 2 dropperfuls from this every 5 hours, if they have it in a dropper, show them what you mean by a dropperful. Take the dropper, put it in the medicine, squeeze it, and show how much fits in a dropper. Or if you say a half dropper, show them that half dropper. Or if you're going to say take a capful, pour it into the top of the cap, and then show them what you mean by a capful or how to put it in water. These visuals will help people, and sometimes important because it's not uncommon when somebody comes back and they say, I need a refill, and you're like, I give you enough for 2 days, and they go, well, I thought that was just enough for the next time I'm supposed to take it. So be clear in your instructions. Sometimes I write it down, but honestly, it's just a lot of work to write stuff down. But if it's necessary, you write it down or have somebody else write it down or just have them write it down so they know how to take your medicines. That will increase your compliance a lot because they know how to. Otherwise, people are often like, what do I do with this again? Right? For most people, they're used to taking pills and capsules, and mostly pills, and they take the pills once a day or twice a day at a prescribed time. We're changing that, and so you have to help them understand how to take herbal medicines regularly. Ways to increase your compliance is just keep it as simple as possible. Once or twice a day is easier than 3 or 4 times a day. Though sometimes I've said with an infection, it's going to be 3 or 4 times a day. But if you can make it once or twice a day, larger amounts, try to do so. If they're taking more than one medicine at a time, if they can take more than, if you give them 2 or 3 things to take, if they can do all of the things at the same time, whether it's once, twice, or 3 times a day, that will increase your compliance. If you say take this before lunch, take this before dinner, and put this on in the morning, and they're all 3 different medicines, you just have lesser compliance. So it's easier to say take the tincture and rub the oil, take these 2 tinctures, and rub the oil on twice a day, somewhere around noon and 7 o'clock at night. So now they have much better idea how to take it. It's much less complex. This is not, I'm not talking about speaking to anybody without an average intelligence, right? We are entered a new frame of how people take medicines with herbal medicines. If they've taken them before, you can ignore all of this. This has to do with people who are new to herbal medicine or just get confused easily about how to take stuff. So trying to limit how many different medicines and how often to take them separately. If you can put the medicine along with a time that they, like if they do certain things every day at a certain time, you can set the medicines up with that time. So like twice a day, once a day they have a jog and once a day they eat dinner. So before they jog and before they eat dinner, just so they have a time where they remember when to take their medicines. So some of this is not so much first aid-y as it is really in chronic health care. But having people take stuff with meals is helpful because when they start to think about it regularly, they'll take it with the meal. Even if the meal is not the best time for them to take it, it will increase the compliance. So some of the reasons people don't take medicines are these, and then you can work against this. In other words, try to figure out how to get around it. So some of the reasons for low compliance is people get confused on how to prepare the medicine. So do they make a tea out of it? Well, that's one of the biggest is, do they make a tea out of it or other ways to prepare a medicine? They get confused on the dosage or regimen of the medicine, how much to take, how often to take. They might not want to take the time out of their day to make the medicine, so teas are important here. A lot of people don't want to make the time to make teas. Other reasons, they may not believe the medicine is helping, and it may not be helping, but if they don't think it's helping, they might stop taking it. And some things like an infection, it might take 2 or 3 days for the herbs to really work strongly, or a day or 2, whatever it is. You might have to say, well, it takes a little while for these anti-infective herbs to work. You should continue taking it, or these anti-inflammatories, or these pain reducers. So the problem with it, of course, is those medicines might not work, and so the patient's going to have to make a decision. Do these medicines work, and should I shift them? You might make that decision with them. With some chronic problems, as the symptoms lessen, they may stop taking the medicine, but it's actually important for them to continue, just like what doctors say with antibiotics, to continue taking the medicine past the time of just some of the symptom lessening. So that's another thing. And I think that that's some of the major considerations with patient diagnosis, assessment, evaluation, and just working with people. I mean, what's going on here? is that you're in a first aid situation, whether it's at a demonstration or at a party, or you're just down the block and somebody runs to you. And people are going to have questions for you, and you have to, it's a human being. You're a human, they're a human. And there's a bunch going on in a really directed, small amount of time. And so how do you reduce the tension? How do you make it feel better? How do you make yourself feel better? And then how do you try assessing what's wrong with them? Because they might be very panicky and how to reduce that. Now, I'm not suggesting giving herbs when people are very panicky initially, because actually it's just, you know, talking them down is a much better idea. Later on, you can give the things that reduce stress for the patients, other people involved, for yourself. But it's an overall consideration, right? So it's not just giving herbs. The person is there, and part of your job is to try to figure out what's wrong, how to look for collateral damage that might have happened, and how to help the patients take the medicines.